I've been practicing medicine for over 3 decades now, and there's one conversation I find myself having more and more with men in my surgery. It's about something that happens quietly, almost invisibly, after 60. The risk of infections goes up, discomfort becomes more common, and frankly, problems with urinary control can become a real issue. But here's what troubles me most. Hardly anyone talks about it. Men suffer in silence, thinking it's just part of getting older. Well, I'm here to tell you it doesn't have to be that way. I'm Dr. Sophie Caldwell, and after 30 years of working with patients across the UK, I've seen how the body changes as we age. The pelvic region, the intimate areas, everything undergoes profound transformations after 60. And while some changes are inevitable, many of the problems men experience can be prevented or managed with the right approach. That's exactly what I want to share with you today. Now, I'm not going to waste your time with endless waffle. I know you lot appreciate straight talking, so I'm going to give you 5 essential recommendations that can make a real difference to your intimate health. These are things that many men simply forget about, or never knew in the first place. But before we dive into the solutions, let me explain what's actually happening to your body. After 60, the tissues in your intimate areas start to change. Blood flow isn't quite what it used to be. The skin becomes thinner, more sensitive. The natural balance of bacteria that keeps you healthy can get disrupted. Your pH levels shift, and suddenly you're more vulnerable to infections, irritation, and all sorts of discomfort. It's not just about sexual function, though that's certainly affected. It's about your overall comfort, your confidence, your quality of life. I've had chaps in their 60s and 70s sit in my consulting room, absolutely mortified to bring this up. They've been dealing with burning sensations, itching, unexpected discharge, or problems with continence for months, sometimes years, before they finally seek help. And you know what the tragedy is? Most of these issues could have been addressed far earlier with simple natural approaches. So let's get stuck in. Here are my 5 recommendations, and I promise you, these aren't complicated medical interventions. These are practical things you can start doing today. First recommendation, proper hygiene, but not the way you might think. Now, I know what you're thinking. Of course I wash myself properly. I'm not a child. But hear me out, because this is where many men go wrong. The intimate area requires a different approach than the rest of your body. After 60, the skin down there becomes more delicate. Using regular soap, especially those heavily fragranced ones, can strip away the natural oils and disrupt the bacterial balance you need to stay healthy. What I recommend to all my patients is switching to a pH-balanced cleanser specifically designed for intimate areas. Your skin's natural pH is slightly acidic, around 5.5, and this acidity is crucial for keeping harmful bacteria at bay. Regular soap is alkaline, often with a pH of 9 or 10, which can throw everything out of balance. When you use harsh soaps daily, you're essentially destroying your natural defenses. Now, I'm not suggesting you need to buy expensive products. There are perfectly good options available at Boots or any chemist. Look for gentle fragrance-free cleansers with a pH between 4.5 and 5.5. Use lukewarm water, never hot, and be gentle. Pat yourself dry rather than rubbing vigorously. This simple change can reduce irritation, prevent infections, and keep you far more comfortable. And whilst we're on the subject of hygiene, let me address something I'm often asked. How often should you wash? The answer is, it depends. After using the toilet, absolutely clean yourself properly. After exercise or sweating, yes. But you don't need to scrub yourself raw 3 times a day. Overwashing can be just as problematic as not washing enough. Once or twice daily with a proper cleanser is sufficient for most men. Right, second recommendation, natural oils for lubrication and protection. Now, this might sound a bit unusual, but stick with me. As we age, the natural moisture in our intimate areas decreases. This can lead to friction, irritation, and increased vulnerability to minor injuries that can become infected. I've seen men develop chronic inflammation simply because their skin has become too dry. The solution: pure, cold-pressed vegetable oils. Coconut oil is my top recommendation. It has natural antimicrobial properties, it's gentle on sensitive skin, and it provides a protective barrier without disrupting your natural bacterial balance. A small amount, applied externally after bathing, can make an enormous difference. Some of my patients tell me it's been absolutely life-changing for their comfort levels. Now, a word of caution here, because I know some of you will have questions. You must use pure, organic, cold-pressed coconut oil, not the refined stuff you cook with, and certainly not anything with added fragrances or chemicals. The same goes if you prefer other oils like sweet almond or jojoba. Quality matters enormously when you're applying something to such sensitive areas. And yes, I've had patients ask about using commercial lubricants or gels instead. Those can be fine, particularly water-based ones, but many contain preservatives, parabens, or other chemicals that can cause irritation in older, more sensitive skin. Natural oils are gentler and often work better for daily comfort, though of course for intimate activities you might prefer specific products. That's a personal choice. One more thing about oils. If you notice any irritation or allergic reaction, stop immediately. Whilst coconut oil is generally very safe, everyone's different. Do a small patch test on your inner arm first if you're concerned about allergies. Third recommendation, and this is crucial: movement and circulation. I cannot stress this enough. One of the biggest factors in maintaining intimate health as you age is blood flow. Good circulation keeps tissues healthy, promotes healing, and maintains normal function. And the best way to improve circulation? Regular movement. Now, I'm not talking about running marathons. I'm talking about daily walks, gentle exercise, activities that get your blood pumping without exhausting you. Even 20 minutes of brisk walking can make a significant difference. Swimming is brilliant if you have access to a pool. Cycling, if your joints allow it, is excellent for pelvic circulation. I've got patients in their 70s who've seen remarkable improvements in their intimate health simply by becoming more active. One gentleman told me that after he started walking his dog twice daily instead of once, problems he'd been having for years simply resolved themselves. That's the power of proper circulation. Beyond general movement, there are specific exercises for the pelvic floor that every man over 60 should know about. These are often called Kegel exercises, and whilst they're frequently associated with women, they're equally important for men. Your pelvic floor muscles support your bladder, bowel, and sexual function. Keeping them strong can prevent incontinence, improve intimate function, and reduce various forms of discomfort. How do you do them? It's quite simple, actually. Next time you're urinating, try to stop the flow midstream. The muscles you use to do that are your pelvic floor muscles. To exercise them, you simply contract those muscles, hold for 5 seconds, then release. Do this 10 to 15 times, 3 times a day. You can do it anywhere, sitting at your desk, watching telly, lying in bed. No one will know you're doing it. I recommend starting gently and building up gradually. Don't overdo it at first, or you might end up sore. But if you stick with it, within a few weeks you should notice improvements in control and function. Some of my patients have reported better results from pelvic floor exercises than from any medication I've prescribed them. Fourth recommendation: understanding and maintaining your pH balance. Right, this is where it gets a bit scientific, but I'll keep it straightforward. Your body maintains a delicate balance of acidity and alkalinity throughout, and your intimate areas are no exception. After 60, this balance becomes more fragile and easier to disrupt. What affects your pH? Diet, hygiene products, medications, even stress. When your pH gets thrown off, the good bacteria that normally keep you healthy can't survive, and harmful bacteria or fungi can take over. This is when you get infections, irritation, persistent discomfort. How do you know if your pH is out of balance? Well, unusual odors, persistent itching, burning sensations, or frequent infections are all warning signs. If you're experiencing any of these, it's worth getting checked out properly. But even if you're not having obvious problems, it's worth taking steps to maintain good pH balance. First, watch your diet. Excessive sugar and processed foods can affect your whole body's pH, including your intimate areas. A balanced diet, rich in vegetables, fruits, whole grains, and lean proteins, helps maintain healthy pH levels throughout your body. Staying well hydrated is equally important. I recommend at least 8 glasses of water daily, more if you're active or it's hot weather. Second, be careful with what comes into contact with your intimate areas. This goes back to my first point about using pH-balanced cleansers. But it's not just about what you wash with. Your underwear matters too. Synthetic fabrics can trap moisture and heat, creating an environment where harmful bacteria thrive. Cotton is far better. It breathes, it absorbs moisture, and it doesn't irritate sensitive skin. And change your underwear daily, obviously. I shouldn't have to say this, but you'd be surprised how many men don't. Fresh, clean cotton underwear every day is a simple but effective way to maintain good intimate health. Some men find that probiotics help maintain healthy bacterial balance. These are supplements containing beneficial bacteria that can support your body's natural flora. Whilst the research is still evolving, many of my patients have found them helpful. Look for products containing lactobacillus strains, which are particularly beneficial for intimate health. Fifth and final recommendation, regular checkups, and don't ignore warning signs. This is perhaps the most important thing I can tell you. After 60, you need to be more vigilant about your intimate health. That means regular medical checkups, but it also means paying attention to what your body is telling you. Many men, I've found, are reluctant to seek help for intimate problems. There's embarrassment, there's a sense that they should just tough it out, there's worry about what the doctor might find. But I'm telling you straight, ignoring problems doesn't make them go away, it makes them worse. What are the warning signs you shouldn't ignore? Persistent pain or discomfort, unusual discharge or bleeding, strong or foul odors that don't go away with washing, difficulty urinating or changes in urinary patterns, lumps, bumps, or skin changes. Any of these warrant a visit to your GP. I've had men come to me with infections that have been festering for months because they were too embarrassed to seek help earlier. By the time they finally come in, what could have been sorted with a simple cream or short course of antibiotics now requires more intensive treatment. Don't be that person. Your GP has seen it all before, I promise you. We're not here to judge. We're here to help. And the earlier you catch potential problems, the easier they are to treat. After 60, I recommend annual checkups, even if you're not having obvious problems. Prevention is always better than cure. Now, let me address some questions that come up frequently, because I know some of you will be wondering about these things. First question. But doctor, I wash with soap every day. Are you telling me that's wrong? Not exactly. Regular soap is fine for most of your body. It's specifically the intimate areas where you need a gentler approach after 60. The skin there is more delicate than elsewhere, and the bacterial balance is more easily disrupted. Think of it like your face. You wouldn't use the same harsh soap on your face that you use on your feet, would you? Same principle applies here. Second question, what about using those antibacterial soaps? Aren't they better? Actually, no. Antibacterial soaps kill all bacteria, including the beneficial ones you need. They can make the problem worse, not better. Stick with gentle pH-balanced cleansers. Third question. You mentioned coconut oil, but what about other natural remedies? What about tea tree oil or something herbal? Right, good question. Some natural products can be helpful, but you need to be careful. Tea tree oil, for instance, is far too strong to use neat on intimate areas. It can cause severe irritation. If you want to use herbal remedies, speak to a qualified herbalist or your GP first. Not everything natural is automatically safe or appropriate. Fourth question, how do I know if I've got an infection or if it's just normal aging? If you're experiencing persistent discomfort, unusual discharge, strong odors, or any symptoms that worry you, get it checked. Don't try to diagnose yourself. What seems like a simple irritation could be a treatable infection, or occasionally something more serious that needs attention. Fifth question, do I really need to do those pelvic floor exercises? They sound a bit, well, feminine. I hear this one a lot, and it drives me mad, frankly. Your pelvic floor doesn't care about gender stereotypes. These muscles are crucial for your bladder control, bowel function, and intimate health. Ignoring them because you think they're for women is just daft. Some of the most athletic masculine men I know do their pelvic floor exercises religiously, and they're better off for it. Let me share something with you. I've been doing this work for 30 years, and I've seen tremendous changes in how we approach health and aging. When I started out, the attitude was very much, well, you're getting old, what do you expect? But we know so much more now. We understand that whilst aging is inevitable, many of the problems associated with aging are preventable or manageable. The men who age most successfully, who maintain their quality of life and independence into their 70s, 80s and beyond, are the ones who take proactive care of their health. They don't wait for problems to become unbearable. They make small, consistent changes to their daily routines. They stay active. They pay attention to nutrition. They use appropriate products. They seek help when needed. And you know what? It's never too late to start. I've had men in their 80s implement these recommendations and see real improvements. Your body is remarkably adaptable, even in later life. Give it the support it needs, and it will respond. One more thing I want to emphasize. Intimate health isn't separate from your overall health. Everything's connected. If you're managing diabetes poorly, it will affect your intimate health. If you're not managing your blood pressure, same thing. If you're not getting enough sleep, drinking too much, or dealing with chronic stress, all of this impacts your intimate well-being. So whilst these 5 recommendations are specifically about intimate health, they're part of a bigger picture. Eat well, stay active, get enough sleep, manage stress, take your medications as prescribed, stay socially connected. All of these things contribute to healthy aging, including healthy intimate aging. I also want to say something about dignity and respect. As we age, there can be a tendency to accept discomfort and problems as inevitable, to feel that we don't deserve better. That's simply not true. You deserve to be comfortable in your own body at any age. You deserve to have these issues taken seriously. You deserve proper care and support. Don't let anyone, including healthcare professionals, brush off your concerns with, well, you're just getting older. Yes, your body changes with age, but that doesn't mean you have to suffer. There are solutions. There are interventions. There are ways to maintain comfort and dignity. Taking care of your intimate health is self-care, pure and simple. It's not vanity. It's not unnecessary fussing. It's about maintaining your quality of life, your comfort, and your independence. It's about being able to enjoy your retirement years without constant discomfort or worry. So here's what I want you to take away from this. Start with one change. Maybe it's switching to a pH-balanced cleanser. Maybe it's adding a daily walk to your routine. Maybe it's finally booking that checkup you've been putting off. Just start somewhere. Then, gradually, incorporate the other recommendations. Give yourself time to adjust to new routines. Be patient with yourself. Remember, you're not trying to turn back the clock. You're simply giving your body the support it needs to age as healthily and comfortably as possible. And please, talk about this. Share this information with your mates, your brothers, your sons. The more we normalize these conversations, the easier it becomes for men to seek help when they need it. There's no shame in taking care of your intimate health. There's no embarrassment in wanting to be comfortable. It's just good sense. I've dedicated my career to helping people age well, and I can tell you with absolute certainty, small changes make a big difference. The 5 recommendations I've shared with you today are simple, practical, and effective. They're based on decades of medical research and my own extensive clinical experience. You don't need expensive treatments or complicated interventions. You just need to pay attention to your body, use the right products, stay active, and seek help when you need it. That's it. That's the formula for maintaining good intimate health after 60. Getting older doesn't mean giving up on comfort, dignity, or quality of life. It means adapting, being proactive, and taking care of yourself with the same attention you'd give to any other important aspect of your health. Your intimate health matters. You matter. And you deserve to feel comfortable and confident in your own body, regardless of your age. So take these recommendations, put them into practice, and notice the difference they make. And if you have questions or concerns, talk to your doctor. We're here to help, not to judge. Your intimate health is just as important as your heart health, your joint health, or any other aspect of your well-being. Right, that's what I wanted to share with you today. 5 essential recommendations for intimate health after 60. Use pH-balanced cleansers. Consider natural oils for comfort and protection. Stay active and do your pelvic floor exercises. Maintain healthy pH balance through diet and lifestyle. And get regular checkups while paying attention to warning signs. These aren't complicated medical interventions. They're simple, practical steps that can make an enormous difference to your comfort and quality of life. And remember, it's never too late to start taking better care of yourself. Your body is remarkably resilient and responsive, even in later life. Look after yourselves, gentlemen. You've earned the right to age comfortably and with dignity.